Our team, welcome back to Plastic Surgery Untold, greatest podcast in the world as voted by us. We got our celebrity crew back. Today we're going to talk about Lumecca, and we're going to talk about a little bit about lasers, treating some spots, treating a few things, maybe more on the superficial layer than we typically talk about. But before we get to the good stuff, let's get to the really good stuff. What's going on in your life, T-Bone?
Oh man, what's new?
What's not new?
What's not new is right. So my wife at Your Trendy Therapist, also her other alter ego at Your Dementia Therapist. I know.
Do we get a kickback for all these
I know, right?
unsolicited promos?
Sorry, it's all coming around. No, she launched her business about 8 months ago at this point, so it's just been growing and getting more clients that are dealing with family members that have dementia and that are the primary caretakers of those people that are living with dementia, and she's educating them and providing, a great service for those families. So we met with her SEO and website team last week. Some really cool stuff on the horizons. She's putting together a series of courses right now that are going to be for caregivers and for families that are living with somebody that is struggling with dementia. So really cool to see that kind of get underway and the progress she's made. So super proud of her.
Awesome.
You're the most supportive husband I've ever met in the world.
I appreciate
Everyone
that.
should take tips.
Ooh, watch out, your trendy therapist. At the nurse injector, Austin is coming for you. You better hold on to your man. Gee, what's going on, dude? On that note.
Yeah. I don't know if I can top that. Not much going on. My family has been visiting recently, so spending some time with them.
Can we say happy birthday to your dad today?
Yeah.
Happy birthday, Papa G?
Yeah, Papa G.
Who's also named Gilbert.
Yeah.
But he's the second, you're the third.
Correct.
Okay, good.
Yeah. It was his birthday actually yesterday. My niece is celebrating her birthday tomorrow, but my brother and sister-in-law planned her birthday yesterday. So it was kind of like a combined birthday party, which was really cool. She turned 2, so she's just a little baby.
But you're not saying that the family tree is a palm tree.
I'm sorry?
The family tree is not a palm tree.
How would that?
Just
I don't understand how you're getting to that from what I just said.
Nurse Sarah, what's going on with you?
Just excited about some new stuff in the office, really, recently.
Like what?
We got some new kits in for skincare stuff. I know Christine
cool.
and I wanted to mention, just to kind of put a little less thought into what products to pick. There are kits that are pre-made that are great for people that are getting filler, getting toxin, and we have those put together already in the office. I think that's pretty cool.
Yeah, we have a post-procedure one for surgery, too.
Oh, I need that.
Yeah.
Just got those in.
I was saying that's what I need. I'm not good at making decisions.
That's why
I also don't know what sunscreen to choose or moisturizer or whatever.
Mm-hmm.
That's the Travis one-stop shop.
There you go.
I've been looking
Yeah.
for.
Well,
Trying
let me
to
tell
make
you
life
about
easy.
Austin Plastic Surgeon's
One-stop.
line of products because
Ooh, yep. There is a sweet line, and we'll come back to this because I think this is what some of today's episodes are about, is the more superficial treatments that we don't always get into because we always think about surgery, injectables, those type of stuff. But if you don't start with the basics, some of the other stuff can be a little bit of a diminishing return, especially as some of us mature just a little bit. But Christine, before we get into the good part, tell us, you got a birthday party coming up?
I have a birthday party coming up, yes, but I wanted to mention...
anyone who wants to go, it's going to be in the river. There's a boat rented. Just hit us up on the DM. We're going to be giving away, 5-7 passes to join you on the boat? Let's just say only 5. Hit us up on the DM, and we will let you know directions, location, and where to go. Thank you, Christine.
Bring drinks.
She's like, BYOB.
Well, no. One of our previous podcasts, you had talked about starting small with like your workout routine and how it would become a habit. And I absolutely hate working out. I've never enjoyed it. I'm also a very busy mom. But I had 2 Eon treatments done and a couple of M sculpts, and I'm really trying. So I've been running twice a week with my dog, and it helps with stress and everything. I feel so good when I do it, and drinking the water. And I've lost 10 pounds in the past 2 weeks.
Congratulations.
So, yeah, it's seeing the results, I think, too, is hard because those first 2 weeks, you don't really see anything. You're just sore and you're miserable. And I'm like, this sucks, and everybody in the office eating cookies and pizza, and I'm walking away, and, so it's tough, but the reward, I think, again, like, just, I feel good,
That's
so
awesome.
that being the best the best part. Yeah.
And
That's great.
honestly, like I think that's the best part of working out and a good diet and exercise routine is like you feel good, you know. And yes, I think looking good comes secondary to that with that consistency and those long-term results. But it's that internal feeling. If I have not gotten to work out, I haven't gotten to run, Mary will be like, all right, you need to go run. You're a bear this week. And it's important to make time for that. 'Cause if you're not taking care of yourself first, you're not going to be able to show up for everything else.
Exactly, yes. And 40 is freaking me out a little bit. My bones are cracking and everything hurts.
You
I'm like,
haven't
"Oh,
even
no."
turned it into
Oh,
to the
no.
best time of your life. Let's do this. Let's jump into our topic a little bit. As much as we'd love to talk about Christine's birthday all day long, which is a great topic, and maybe we'll have a little bit more after. And those of you that win your lucky tickets to go to her party, please let us know how it turns out. But let's talk about Lumecca and this type of laser, because I think that, and I'll tell you, before I really got into aesthetics and really understood more about this, I think some people have the perception that all lasers are the same and treat the same things, and that's not true. I was gonna say not necessarily true, but not true across the board. And so, what does Lumecca specifically do? What does it treat? How is this helpful? Because I think sometimes people want to treat stuff, but they don't even know what or where to go or what to do.
Yeah, I think.
You want to give us a little background?
Yeah, I mean, I
Okay,
think
yeah.
a lot of patients don't refer to it as IPL. I think people know more commonly referred to as photofacial or photo rejuvenation. IPL stands for intense pulse light, and it searches for damaged skin cells, so browns, reds, and it brings it to the surface. Little brown spots will kind of flake off over time. Helps with redness and all kinds of stuff. So I love this device that we have. Lumecca is super powerful. I think, it's really important to educate the patient on sun prior to the treatment and after, and really having to investigate and making sure that your patient, knows what's sun exposure is, because people will tell you that they haven't been in the sun and I will see tan lines on them, but they were at the beach 2 weeks ago or whatever. So I think
But that didn't count.
Right, but it does. With laser, it does.
What happened
So,
in the past 24 hours?
Yeah, so summertime is hard, but there are ways to still get your treatments done and be safe about it. But I mean, I've been doing IPL for 12, 13 years now, and I mean, it's a game changer. So,
And there's a couple different devices that all use this different intense pulse light and so different names for them as well. And I think sometimes it's confusing because there's so many different devices. They each kind of have a different name. Maybe we'll take a step back, and you already alluded to it, and we've talked about it on a few other episodes, is how important the treatment is before and after. And I think, sometimes people are willing to spend all this money on some of these laser treatments, but then they're not on a good sunscreen, they're not on a good hydrating treatment stuff, and it almost becomes self-defeating because then you come in this cycle and you're not really getting the results you want. You're disappointed, you're spending a lot of money, and when there's some simple things you could have done to prevent this and then to maintain. Do you want to maybe start from the beginning, like what should people start with, what do they need to do afterwards, and then maybe we can jump into a little bit more about what are not treated by this, because I think sometimes people get confused, and G and Sarah can jump in at any time and help us with this.
yeah. I guess I can go with the skincare stuff.
Yeah, start there. Let's start at the beginning.
So when a patient comes in, and again, I ask them, what's your biggest concern with your skin? I also go into what are you using at home? So I get a better idea if they're using good products or, not good products. And then just educating them on how sunscreen works. Gilbert and I had a really good conversation about sunscreen last week, about the numbers on the sunscreen and how long sunscreen lasts. Because I think just
Ooh, can
putting
you
it-
share that
I was
knowledge
about
with
to
us?
say, wait a second. Don't leave me in the
It
dark.
was really enlightening, but and even for me, I've been selling sunscreen forever, but I still, needed some clarification on the
Yeah,
actual number.
give me-
Before we
me
get
Cliff
Gilbert,
Notes.
can you give
Yeah.
us a little info? I feel like this is a good one for people.
Yeah, that's a great
So
point.
essentially, what the SPF number means is it's not necessarily a way of determining whether one sunscreen is stronger than another sunscreen. It basically boils down to how much time goes in between reapplying the product. So the lower the number, the more frequently you have to reapply the sunscreen in order for it to be effective. The higher the number, the less frequently. You should still be reapplying, but you don't have to reapply quite as often. So for example, let's say, well, in dermatology, we would always recommend a bare minimum of at least an SPF of 30. And so I would tell my patients, with an SPF of 30, you should be reapplying this sunscreen about every hour, hour and a half, more or less, depending on your activities. If you're in and out of the water, you want to be reapplying as soon as you come out of the water, because even though sunscreen says it's waterproof or water resistant, it still washes off. So you want to be reapplying, but if you're just outside at a barbecue or, hanging out, you want to be reapplying about once every hour, hour and a half. Otherwise, past that point, it's like you're not wearing anything at all, right?
And at a barbecue in Texas right now where you're sweating, you might as well be in the ocean.
Yeah. Exactly. With a higher number, like let's say an SPF of 50 or 75, you can maybe go like 2 or 3 hours in between reapplying. But that's essentially what that SPF number boils down to.
And it does vary from person to person, because if you're more sensitive to sun in general, you're
Right.
still going to need to apply more frequently, correct?
Correct. And then, and to piggyback on that, there's a difference in sunscreens too. There are sunscreens that are called physical blocks, and then there are sunscreens that are called chemical blocks. A physical block is going to be a sunscreen that has either zinc oxide or titanium dioxide as their active ingredients, whereas the chemical blocks are going to be the sunscreens that you may be more familiar with, that have all these other different, chemical names to them, which are still good, but your best ones, in my opinion, after practicing in dermatology for as long as I did, were the physical blocks, because they physically create a barrier between you and the sun, whereas the others are chemicals that you're putting on your skin that could possibly be absorbed into the skin to some degree, which then kind of creates some blocking effect, but not the same as those of a physical sunscreen.
And I think sometimes people have the misconception that getting a good medical grade sunscreen moisturizer is crazy expensive. But when you look at, let's take my mom for example, all the stuff she has in her shelf of like random stuff that she's picked up from Macy's, Nordstrom's, Target, and all those are great stores. I shop at all of them. But, you start to get this collection of stuff that doesn't have any rhyme or reason or any purpose. It may not even be the best product for your skin. And then you get yourself into spending just as much money as you would with a couple of quality products that you're going to lead us through.
Yeah, and I think with some of the medical sunscreens, they're not that much more. I mean, the sunscreens at Walgreens are $15, $16. If you turn them around on the back, not a lot of them have zinc oxide. So you're just paying a couple more dollars, $25, $30 for a really good sunscreen that's really going to protect you.
Save you a lot of money down the road.
Yeah, definitely. And you're protecting your investment. Like you said earlier, you don't want to pay for all this money to get laser treatments and remove all these sunspots, and then you're going in the sun or not using good product to maintain or help those results last.
Or risking skin cancer, for that matter.
Yes, more importantly, yes, absolutely.
And another good point, if you have spots or stuff that you're not worried about, that you are worried about, you should definitely make sure that you're bringing them to the attention of, you should be getting a skin check. Gilbert, you can tell us more about that, and then bring them to the attention of your, if you're only going to if you're seeing a family practice doctor or getting your annual physical, if there's spots you're worried about, don't just brush them off, because catching something early really nips it in the bud. Letting stuff go becomes a big deal.
Yes, I'm a huge advocate for that. If I have ladies in the office that have multiple spots, I usually ask them, have you been to a derm? And try to just have that conversation. It's probably wise for you to get a spot check once a year, just because I've seen a lot of that stuff come through, and I've seen, Mohs surgeries and stuff on random places, ears, scalps, places you don't think about. So that's super important. But I think as far as the Lumecca goes, the reason we want to protect our skin before a laser treatment, if you go get a suntan or a sunburn before Lumecca, your skin's compromised already. And the last thing we want to do is take heat or light to compromised skin. We can cause a burn. So you're just at higher risk for bad things to happen, So it's really important, I think, to be honest with your provider. There's nothing wrong with rescheduling a week later, or even we did a test spot on a lady the other day just because she was super nervous about it. And she was fine. So, but yeah, sunscreen's super important. Vitamin C's to help, antioxidants help reverse and sun damage and free radicals, pollution, things like that. So it doesn't have to be 10 products, but 2 or 3 good medical grade products will help your results last longer. And you just want healthy skin. I think a lot of derms like to prep patients' skin even before these treatments to see like what we can get out of the product, putting somebody on a Retin-A, getting them to exfoliate, getting them to hydrate, prior to the treatment just for the best results. We don't want to just do the laser treatment on you and send you on your way. Your money needs to go a lot farther than that. So
and just to finish the topic on sun and sun exposure and sunscreen, how about after the treatment? Because you're at risk for causing problems for yourself if you get one of these treatments and then go out and lay by the pool the next day.
Yeah, I definitely ask them
what do you
your
typically
plans.
recommend for people?
I mean, I don't want them in the sun for 2 weeks prior, 2 weeks after, and I mean, that's laying out in the sun. The to and from the store, put sunscreen on, wear a hat, just be diligent with it. But as far as like going on a cruise the following week, absolutely not. Absolutely not. You're just going to, cause more damage, and just reverse everything that we just did,
Yeah.
so.
Anything that you need to do differently in terms of sunscreen other than just being careful with not laying out at the pool, or other stuff you guys would recommend after treatments like this? If not, then that's okay.
No. I mean, that's
just
pretty
being
much
diligent.
just being diligent.
Okay. So it's easy.
Sun protection, sunscreen use, sun avoidance.
Yeah, and with the Lumecca, you do get, I like to call them coffee grounds because that's just what it looks like. But the spots get darker almost immediately during the treatment. And then over the course of a few days, they rise to the surface of the skin. And you can feel a little texture. They feel a little rough. So moisturizing those and not picking them off. I have patients that just could not help themselves and pick the scab off too early. And that is part of the healing process. So when that happens, you're causing hypopigmentation. You can take the pigment out of the skin, which is super hard to correct later. So, I'm very verbal. It's almost a warning. Like, do not pick your skin. Do not do these things. And we send them home with a little post-care card so they don't have to remember all of this. But, yeah, just treat your skin gently and wear the heck out of your sunscreen. So, yeah.
But so if I'm doing this procedure and I'm planning like my life and stuff, how much downtime do I have? Can I do stuff? What am I going to look like? What should I plan? If I have a wedding I want to go to, can I do this the day before? Should I not? Catch us up where we're at.
Yeah, Sarah's had this done. So, yeah, tell us a little bit.
So I'm someone who struggles with hyperpigmentation and brown spots on my face. I've been putting it off for a while, and now that I'm finally in the mix,
and we're going to get back to pigmentation on the face and melasma because they're different, right? And so,
yes.
So I just don't want to confuse people, but we'll talk about that. But continue, because sometimes not all spots on the face are
treatable.
Are the same.
And I think that's a good point to make. Maybe Gilbert can help us out with that too in a minute, as far as what is treatable and what's not treatable. But personally, I have been crazy with staying out of the sun, crazy with covering my face, because I did do a peel for my pigmentation. Then I did one treatment of Lumecca. And personally, somebody who feels that they return so easily, it takes a lot shorter of a time than you think. If I were to go out in the sun for 20 minutes, I have like 10 new spots. So I think it's just being really diligent about knowing your skin too, and knowing how quickly it returns, because you don't want to spend thousands of dollars on these treatments only to turn around and ruin it the next week.
But so from a Cliff Notes standpoint, if I have a big event that I'm worried about, what's the closest amount of time that I should do, like, one of these IPL treatments prior to that?
I would say 2 or 3 weeks.
To be on the safe side, 2 weeks. It's everybody's different. I don't know if it has something to do with age and cell turnover, but some of my younger patients, the spots flake off really quickly within a matter of days. And then, my mom's in her 60s and her spots hung on for 2 weeks. They
when we did my treatment, I definitely had a few that fell right off, and others took about 7 to 10 days. So I think 2 weeks out is good, because the other thing to think of with the Lumecca, it's a great treatment, but it darkens them initially. And so you don't want to have a wedding in a week, and now your spots that you don't like are 10 times darker because you're waiting on them to fall off. So
it's one of those treatments that looks worse before it gets better.
Absolutely. I think it's a good point to make.
Yeah.
And for T-Bone here, this is to be a procedure that we don't need celebrity anesthesia. Is that correct?
Yeah, there is.
That makes me super happy if that's true.
Yeah, you do not topically numb for Lumecca.
And you're also not asleep.
Yeah, you're not asleep. You're awake. It does feel just like a very tiny, tiny little rubber band, though. It's very tolerable. And then to Gilbert's point, we do have Pronox in the office. So if you need a little bit more help with discomfort, you can do some Pronox.
How does it feel that you've been replaced by a little machine that you can suck on?
How am I supposed to get a G5 if
we don't need you?
Yeah, if you guys start needing it. This is ridiculous. I'll be there for moral support. If anybody needs me to come in and hold their hand during the procedure,
sometimes I just like you to tap on their shoulder.
We can
have you come and do
we
this.
like in the industry we call that.
Travis come in and do a little distraction technique?
Yeah, we call that there anesthesia.
Okay,
perfect.
There. We need
that. We have
so coming soon, celebrity anesthesia, doing a little there
that's
anesthesia.
Right.
So
perfect.
Nothing but the best for our patients.
That's right.
It's all about comfort.
Can we Gilbert, do you mind, maybe between you and Christy, who's a good patient for a good candidate for Lumecca IPL treatments? Who's not? Because we alluded to a minute ago, not all spots on the face are the same. Some are very well treated, others are not.
Yeah. So at the very foundation of it all, essentially people with lighter skin tones are excellent candidates. Darker skin tones cannot be treated with Lumecca. There is this whole grading system in dermatology called the Fitzpatrick scale, where it grades individuals from a grade 1 to a grade 6 in terms of how fair they are to how dark complected they are. 1 being the fairest, 6 being the darkest. So essentially anyone who's like a 5 or 6 cannot get Lumecca treatment because of the amount of pigment that they have in their skin. And introducing heat and light to those types of patients is going to trigger hyperpigmentation or dark spots. So it's going to create problems as opposed to help problems. Anyone who's like a 1, 2, 3, 4, those are good candidate patients. And 3, 4, you still have to be careful because those individuals can still hyperpigment, but they're in a safer spot than someone who's a 5, 6. Okay. And just to kind of give you some examples of what each number kind of represents, someone who's a 1 would probably be like a fair complected individual with light colored eyes, light colored hair, reddish hair, things like that. Someone who freckles very easily when they're out in the sun. Someone who's like a 3 or 4 might be someone who is of like Hispanic or Middle Eastern descent, maybe even some Asian descent, and then 5, 6, you're kind of getting into more of like darker complected individuals, either like really, really dark Middle Eastern, dark Hispanics, African Americans, things along those lines. So to kind of give you an idea of, who might be a good candidate, who isn't.
What about because then one of the things that we see a lot is melasma. Is IPL, is the laser treatment for melasma, or is there a better treatment for that people want to know? Anybody want to answer that one? Because I feel like this is one where people get confused on.
So going back to the consultation, I try to identify what those spots are when I see my patients. So I ask a couple questions. There's usually some characteristics with melasma that can be seen: cheeks, upper lip, forehead usually, and then hormonal changes, stuff like that. If they're just kind of like freckle looking, sunspots, the shape of them, where they are, how long they've been there, and also still getting my patient's history. Were you in the military? Have you spent all your life in the sun? Were you a farmer? Stuff like that.
Did this come after pregnancy?
Right. Maybe somebody never, I've worn sunscreen all my life, but this showed up after my baby. Then I'm like, boom, it's probably melasma. And if I'm unsure, then I'll grab Gilbert. I love having him in the office just to kind of, second set of eyes, make sure that I'm selecting the right treatment for the patient.
But why is it important I guess the point I'm getting to is, why is it important to know whether it's melasma or sunspots?
So heat can make melasma worse. It can force those melanocytes to overstimulate and cause the pigment to get darker. So chemical peels are usually the route to go for melasma, with compound creams, retinol brighteners, stuff like that. So much safer to do that. Yeah.
And that was the point I was trying to get to, is that this treatment's great. It's not for everything. And then this is the point of seeing some providers that are going to help spend a little bit of time actually talking to you, going over through this, because we're going to help guide you to the right treatment. Because I think the Lumecca IPLs are great and they really help a lot of people, but they're not the treatment for everything. We talked about in one of our previous episodes, hammer works great for a lot of things, but not for everything.
Mm-hmm. Yep.
Is that true for anesthesia?
100%, yeah. We in our business, we have the expression, there's 1,000 ways to skin a cat. A lot of them get us to that endpoint that we're looking for. General anesthesia, pain relief, blah blah blah, whatever we're doing. But there's a million ways to get there, and I think skincare is very similar, right? You want to get to that patient's end result. How you're getting there, totally different with those different tools in your tool belt.
I mean, just for the people listening too, no cats were actually injured.
I'm sorry, PETA. I apologize. Yeah.
What other
it's
important
speech?
We've talked about face, but can you use IPL in the neck, chest, or other areas of the body?
Yeah, we
Yeah.
treat
I
neck,
feel like bikinis are getting smaller and smaller, and we gotta be looking good all over.
neck, chest, and hands. I feel like hands is another great spot for Lumecca. Everyone gets the age spots. We've actually done quite a few in the office that I believe are posted on our Instagram, Austin Plastic Surgeon. You could check out some great before and afters. Mixed with filler and things like that, we can really rejuvenate the hands.
Yeah,
That's
I did some shoulders. I had a girl that had freckling all over
Perfect.
her
Yeah, that's a
shoulders and
great one.
arms, and that one turned out really well. And she's, like Gilbert said, the lighter the skin type, the lower the risk. So we're able to kind of turn it up a little bit and get aggressive. So 2 treatments, the spots were almost gone.
That's awesome.
It's pretty impressive.
And what about timing? Because I know sometimes with peel, sometimes with laser stuff, tend to be something that I've always heard the dogma that they're better in the winter than the summer. Is true? Not true? Is that fact or fiction?
I mean, I guess it would be a fact that it's
Oh, okay.
safer to do them in the fall, but
Is that mostly because it's the
Just
weather's
because-
not great and we're not out in the sun?
Right, exactly.
Okay.
Exactly. Because people are usually busy and doing things during the summer. But if you're that person that's going to, plan to be home for a week or two and you have time to do that, I think we can still do these treatments during the summer. But again, it's having that conversation. It's super important that you don't get sun exposure and kind of listening to your patient too if they're talking about a trip. Because sometimes you have that conversation and then you're getting ready to do the treatment. They're like, oh, yeah, I can't wait to go to Cabo. And I'm like, wait, what? So that's important. You really have to.
So maybe
Have a
doing some of these treatments right before you're getting your mommy makeover because you're gonna be home anyway.
Yeah.
And so then you can have a little downtime. So.
I've totally done that. Seen one of your patients 2 weeks prior because she's like, I want to be home. I have time to peel. Yeah, let's do it.
That's a great
Okay,
idea.
Yeah.
cool. What other nuggets would you guys like people to know about IPL and these treatments? I feel like we've talked about pre, post care, being careful about that, and some of those nuggets.
I think another great point to make about Lumecca is it also treats red tones. We mentioned that earlier, but one of the things that I feel like a lot of our patients are super excited about is the little broken capillaries and little vascular lesions on the face. I don't think we realize how many we have until we get them in the room and we shine the light and we actually show them. But they make such a significant difference on the cheeks, around the nose, and that's pretty instant. If we have the energy just right, we can get rid of them with 1 or 2 treatments.
It's awesome.
Yeah.
I think it's also helpful for scars, especially
Ooh,
talking
yes.
about
Yes.
talking about the reds in red tones in the skin. As a scar heals, when a scar first forms, it's typically in that reddish hue before it eventually kind of fades away to white, and that's kind of just like the progression of a scar in terms of color. And so when it's in that reddish hue and that reddish tone where it's like reddish, purplish, pinkish color, you can actually draw out some of that redness in those incision lines and improve the appearance of the scar fairly quickly.
And it's funny because you get a lot of people who the redness does get better on its own with some time, but sometimes time is like a year and a half, and so people who want some of that color out a lot faster. I do think this works great to get some of those things out. How about bruises? Does it help get bruises out a little bit faster at all, or not really when you talk about?
So, in my experience, I think that there are other treatment modalities that are better for bruises than IPL. I can't say that I have a lot of experience treating bruises with IPL, but I have treated bruises with other devices, something called pulse dye laser or PDL laser, which targets more of the like hemoglobin and the hemosiderin in the skin. So I think those work a little bit better for bruises. That's been my experience.
And sometimes people ask, but just so everyone's clear, IPL is not a skin tightening device, and so this is a little bit different, and this is why we have multiple things in the office per se.
So that would not be the device that I would go to for skin tightening, but you do get a little bit of collagen stimulation just with the light. Just that's why people call it the photo rejuvenation, photo facial. So I think there's a little bit, but if somebody came in just for skin tightening, that's not the route I would go. Yeah.
And it's just, and this is where the consultation is super helpful, is to help make sure that you get the right treatment. And we see it with our injectables all the time. Somebody comes in and says, I want Botox, but they really, need some filler, they need some other things. And sometimes it's a combination of these treatments, and there's only so much we can do at one time. I can't really do peel, laser, Botox, everything in like 1 30-minute session stuff. And we have this with some of our surgery patients. Like, let's figure out what bothers you the most. Let's come up with a good game plan. And sometimes that game plan takes takes time.
Mhm.
So with the Lumecca and Morpheus, you can actually do them together in the same appointment. I would do the Lumecca first because we're working with the surface of the skin, and then I would apply numbing cream for about 30 minutes, roll in the Pronox if they need it, and then do the Morpheus. That takes about another 30 minutes if we're just doing face. So, I mean, if you can get them all done in one shot, you know.
No question. I
Yeah.
think the more you can get done or things, because it's hard for people to get time off. If they're going to have a
Mhm.
little downtime, that's great. And I think this is where the provider kind of helping guide you a little bit of what we can and what we can't do in one setting. And sometimes
Yeah.
there's things you can do. We just got to adjust the order a little bit.
Yeah, we got to be careful with injectables and spa stuff. And our the scheduling team I think is really good about making sure that they're because you can't lay back after Botox, and you don't want to get filler and then come get a facial or because we'll be pressing around in areas that are tender and we don't want to move products. So I think that's the order of operation is super important.
Yeah, they see you first and then us.
Awesome. Any last kind of IPL laser tip stuff that you guys want to leave our listeners with?
Just a couple other things that
Yeah.
we didn't mention in
Yeah.
terms of what it might be helpful for are acne scars,
Mhm.
stretch marks, the appearance of stretch marks too. Those are some other areas where I think it can help minimize the appearance of them. I mean, it's not going to make them go away entirely, but I think it's important to note that there is some improvement in the appearance of those with the Lumecca treatment.
And the stretch marks, isn't that another one where sometimes people can really benefit from a combo treatment
Mhm.
because they treat different stuff as we've talked about here, right? So
Yeah.
so doesn't the Lumecca help get some of the redness and color out of the stretch marks where the Morpheus, the RF might help just tighten up that skin a little bit and maybe
Exactly.
smooth them down
Texture.
just a little bit?
Yeah.
I think that's another great example to what Christine said earlier of where sometimes a combo treatment is great, and this is where we can help them a little bit. And I definitely feel like we get people come in, they want one, and we're like, that's and I think Travis maybe said on the last podcast where it's figuring out what their actual concern is, and we spend a lot of times, and I know sometimes it seems redundant asking you 1,000 questions, but we're really trying to figure out what bothers you, and so that we can help you get to a spot that's going to fix that
Yeah.
or improve it at least.
Yeah. No, I agree.
I learned early on in my career not to point out somebody's flaws before they speak because I had a woman that I thought she was there for spots because she was covered in them, and I just assumed, and she said the spots didn't bother her, and she was super offended. So I like to let them speak and tell me what bothers them because it may just be something really simple, and we don't need to spend thousands of dollars on.
It's such a good point because even when I know somebody's here for a breast talk, I'll always just ask them like, what can I help you with? What can I do for you? Because even the way they present it always tends to lead you a little bit of what their mindset is in terms of what their overall goal. And I feel like if you over direct them, then it doesn't let their true kind of concern come out sometimes.
Yeah, another great
Completely
tip that
agree.
I have, I've loved Real Self, and we've done some events with them, and I know you're really, really, incorporated with them as well. I tell a lot of my patients what's great about the website is you can go type in 40-year-old female sun damage Morpheus, and you can get all of these before and afters. And so sometimes I'll send them there if they're not quite all the way sold on it and they just want to see what to expect. Go on there and scroll through, hundreds of photos so that you have a realistic expectation of what to expect. And there's tons of good stuff on there.
Go over to any other nuggets? That was a good one, the scars.
No, I think that pretty much covers it.
Awesome.
Yeah.
Any behind the bovie nuggets you guys would like to leave us with?
I am still working on this booty facial. It's a kind of a facial to help brighten dark spots on the butt cheeks, and what was the other one? Ingrowns, like acne. A lot of ingrown hairs, little bumps, stuff like that. So coming up with like a light peel or an exfoliation process, little hydrofacial on the buttocks.
Okay.
Yeah, so something in the works on that.
Okay. Some stuff to come.
Yeah.
I
So
like
I got a behind the bovie nugget for
Oh,
you
yeah, give it to us.
about Lumecca.
Okay.
What kind of sets Lumecca apart from other IPL devices is the fact that it's able to treat these pigmented lesions at energy that is 3 times stronger than most other IPL treatments safely and with less discomfort, meaning that it will get you to the endpoint that you're looking for in fewer treatments. So that's one of the
We like that.
Yeah.
Cool.
So it's 3 times stronger and gets you where you want to be sooner.
Yeah.
Okay.
The lasers are like cell phones. They come out with new ones all the time. They're better, they're faster, and this one, just again using my mom as an example, I've treated her with several different IPLs in the past, and this one she said was the most comfortable out of all of them.
Oh, great.
So
I'm
yeah.
super impressed with it. I mean, for how amazing the results are, the downtime is minimal compared to a lot of stuff you see on the market. So
Well, hopefully we don't have to replace this one every 6 months. Like
No.
mine.
yeah, no,
But,
we plan to keep this one.
Can we do a quote of the day?
I
Either you
think
give us a quote.
I think G's got this one.
Oh, you got a quote? Okay.
Yeah, I got a quote. So I found this one to be kind of interesting. It doesn't necessarily apply to our podcast today, but I thought it was pretty cool. Max Lucado said, "A man who wants to lead the orchestra must turn his back on the crowd." So, like, essentially what that means is, if you want to be a leader, you can't let, the crowd be an influence on you in any way. So you got to just, do what you're going to do, and don't allow anyone to be a naysayer or hold you back or, do anything. But in order to make beautiful music, you got to turn your back on the crowd.
Damn, that's a good one.
I like it.
I like
I like that.
it.
I like
Yeah.
that.
I like that. Well, on that note, see what I did there?
Yeah.
On that note, thank all of you for listening to Plastic Surgery Untold, greatest podcast in the world, as voted by us. You can download us anywhere you get your favorite podcast: iTunes, iHeart, Pandora, Spotify, and tons more. So we'll see you guys soon. All right, bye.